Hello, and welcome to another episode in our Smarter in Minutes series. I'm Dayna McManus, Pharmacy Supervisor for Infectious Diseases at Yale New Haven Hospital in New Haven, Connecticut. I'm joined by my colleague, Dr. Natasha Bhuyan, Assistant Clinical Professor of Family, Community, and Preventative Medicine at the University of Arizona in Phoenix, Arizona.
Hi, Dayna. Thank you so much for having me.
Thank you for being here. Over the next few months, we'll be posting a series of these short CME certified videos focused on the management of patients with COVID in the outpatient setting. This activity is jointly provided by National Jewish Health and Bonum CE. The program has been supported by an educational grant from Pfizer. Please be sure to let us know who you are and complete the pre-poll in the tweets below or using the QR code shown on the screen. So today we will be talking about molnupiravir in the outpatient setting for the treatment of mild to moderate COVID-19. Now, molnupiravir is an oral prodrug of a compound that has antiviral activity against SARS-CoV-2 in vitro and in some clinical trials. Specifically, it inhibits SARS-CoV-2 replication when it is uptaken by the viral RNA-dependent RNA polymerases, which results in viral mutations and lethal mutagenesis. On December 23rd, 2021, the Food and Drug Administration, FDA, issued an emergency use authorization, or EUA, for molnupiravir for the treatment of adult patients with mild to moderate COVID who are within 5 days of symptom onset and at high risk for progression to severe disease, and in whom alternative antiviral therapies are not accessible or not clinically appropriate. Some high-risk conditions include age, overweight and obese, cancer, diabetes, chronic kidney disease, chronic lung disease, and other heart conditions. Molnupiravir is not authorized for people aged less than 18 due to potential effects on bone and cartilage growth. In addition, molnupiravir can be administered with or without food. Specifically, molnupiravir is an alternative option when agents such as Paxlovid or remdesivir are not feasible or not clinically appropriate. In terms of its dosing, molnupiravir is given as an 800 milligram twice-a-day dose for 5 days. This drug comes as 200 milligram capsules. So each dose is 4 of these 200 milligram capsules to equal the 800 milligram dose twice a day. It also has to be started within 5 days of symptom onset. It can be administered via nasogastric or orogastric tube as well. Both males and females of reproductive potential who have intercourse with the opposite sex can take molnupiravir. However, they should use reliable and consistent contraception through the use of molnupiravir. Specifically, the duration varies. So for females of childbearing potential, they should use reliable methods of contraceptive correctly and consistently for the duration of treatment and for at least 4 days after the last dose of molnupiravir. Males of reproductive potential who are sexually active with females of childbearing potential should use a reliable method of contraception correctly and consistently during treatment with molnupiravir and for at least 3 months after the last dose of molnupiravir. In addition, molnupiravir is not recommended for use in pregnant or lactating women. Now, Natasha, can you tell us about the trial that led to this indication for molnupiravir?
Yes, this was a pivotal outpatient trial for molnupiravir called MOVE Out. This was a phase 3, double-blind, randomized, placebo-controlled trial to evaluate the safety and efficacy of molnupiravir in high-risk individuals. The medicine was administered within 5 days of COVID symptom onset. It was about 1,400 unvaccinated, non-hospitalized adults with mild to moderate lab-confirmed positive COVID tests. Half received molnupiravir, while the other half received placebo. And they were randomized to receive 800 milligrams of molnupiravir twice daily for 5 days. The primary efficacy endpoint was incidence of hospitalization or death at day 29. And the interim analysis results showed the risk of hospitalization for any cause or death through day 29 was lower with molnupiravir compared to placebo. The difference was about 6.8 percentage points. And the risk of death was lowered by 89% with molnupiravir than with placebo. All 14 participants had been hospitalized before death, and all of the deaths were considered by the investigators to be COVID-19 related. A secondary analysis of data from the patients who were hospitalized during the trial revealed that the use of molnupiravir reduced the risk of requiring respiratory interventions. This is things like conventional or high-flow oxygen delivery, non-invasive ventilation, or mechanical ventilation. That risk was reduced by 21%. There was no significant differences between the arms in the proportion of patients who experienced adverse safety or serious adverse events. Now, PANORAMIC is another trial. This was a large trial with about 25,000 patients, multi-center, open-label, adaptive platform trial that was conducted in the UK during the Omicron dominant era. That was from about December 2021 until April 2022. And they evaluated the use of molnupiravir in non-hospitalized adults who were at high risk of progression to severe COVID-19. The primary endpoint in this trial was a composite of all-cause hospitalization defined as greater than 1 overnight hospital stay or 1 night at home with care and monitoring by hospital clinicians, or an overnight stay in an emergency room. The endpoint was also death within 28 days of randomization. In this trial, 94% of the patients had received greater than 3 doses of a COVID-19 vaccine, and 69% of patients had comorbidities. The results of this trial in both arms, approximately 1% of patients were hospitalized or died. There were 103 hospitalizations and 3 deaths in the molnupiravir arm, compared with 96 hospitalizations and 5 deaths in the usual care alone arm. The secondary endpoints were the time from randomization to self-reported first recovery. It was significantly shorter among those who received molnupiravir, a median of 9 days, than those who received usual care alone, a median of 15 days. After adjusting for age and baseline comorbidities, molnupiravir significantly reduced the estimated median time to first recovery. The median time to first recovery was 10.4 days in the molnupiravir arm and 14.6 days in the usual care alone arm. The use of molnupiravir also significantly reduced the time to early sustained recovery, defined as recovery by day 14 that was sustained until day 28. The time to sustained recovery, the time to alleviation of all symptoms, and the time to sustained alleviation of all symptoms, and the time to initial reduction of symptom severity. In terms of safety, serious adverse events occurred in 0.4% of patients in the molnupiravir arm and 0.3% of patients in the usual care alone arm. No serious adverse events related to molnupiravir were reported. 145 patients, which is about 1.1%, withdrew because of adverse events attributed to molnupiravir. So Dayna, what do we know about the safety of molnupiravir?
Well, we do know that the most common side effects of molnupiravir are diarrhea, nausea, and dizziness. Interestingly, based on in vitro studies, neither molnupiravir nor its active metabolite, abbreviated NHC, are inhibitors or inducers of major drug metabolizing enzymes or inhibitors of major drug transporters. Therefore, according to the FDA's EUA, there are no drug-drug interactions that have been identified for molnupiravir. Neither molnupiravir nor its metabolite NHC are inhibitors or inducers of any major drug metabolizing enzymes or inhibitors of transporters. No dose adjustments are needed for hepatic or renal impairment. Sexually active people of reproductive potential who have opposite sex partners should use effective contraception during and after treatment with molnupiravir, as I highlighted previously. And also, as mentioned as part of the FDA approval, molnupiravir should not be used in persons less than 18 years of age due to the potential effects on bone and cartilage growth. So, Natasha, after covering so much information, could you summarize some key points of our discussion for our learners, please?
The key takeaways from today's discussion are: molnupiravir is available through an EUA as an alternative to COVID-19 therapy for non-hospitalized adult patients when Paxlovid or remdesivir are not feasible or clinically appropriate, such as drug-drug interactions or hepatic and renal impairment. 2 large clinical trials in the outpatient setting showed mixed results, but trended toward benefits. Consider molnupiravir when patients have potential for drug-drug interactions with medications with other antivirals and/or when remdesivir is too complicated for patient adherence. Molnupiravir should not be used in pediatric patients as it's not been studied, and sexually active people with reproductive potential should use effective contraception before and after treatment with molnupiravir.
Thank you so much for joining us. Please complete the post polls in the tweets below or by using the QR code shown on the screen. And don't forget to claim your free CME. Click like and follow for more social media-based CME from Bonum CE.